My name is Dr. Roger Fonts, orthopedic surgeon in Henderson, Nevada. I was on call at University Medical Center, and he came in with a knee injury. At that point, he had an anterior cruciate ligament tear. It was a serious injury, especially given his line of activity. I mean, he's a guy that needs 100% out of his knees, and with an unstable knee, I couldn't do the activities that he normally wants to do.
So what was your thought? So you took into account the fact that he wanted to go on and do records, and you did something special that would not do with a regular patient?
Well, I mean, an anterior cruciate ligament surgery is actually a fairly common operation, but there are patients who don't require a ligament reconstruction if they have tears. So someone who's just a non-athlete who tears their Achilles doesn't require surgery, but for someone who's involved in the kind of activities that he is, he can't do that without a cruciate ligament. So you know, a relatively standard surgery, but with extraordinary indications, I guess would be how I would describe it. I joke with Jesus that he needs a frequent flyer card, because shortly after his anterior cruciate surgery, he got through rehab, did beautifully. He's starting his training for one of his world records, and comes in, tore his Achilles tendon. So we had to go take him to surgery again to fix his Achilles. That's another surgery. That pretty much is done for almost everybody who tears an Achilles, but it's difficult to recover from. That's a surgery and a recovery that's months and months. It's very hard to get your strength back, and he worked very hard to get back to the level that he's at right now. I hadn't seen him for a while after his Achilles, and then he shows up in my office one day, you know, indicating that he was having some groin pain, and that's pretty classic for hip arthritis, but you wouldn't expect it in someone his age. I was shocked when we put his x-rays up on the board and he's got advanced arthritis. At his age, hip arthritis is really rare, but it was giving him severe pain. Obviously couldn't do any of the things that he normally does, even just normal activities, let alone the kinds of you know, superhuman activities that he does. Yeah, we have a variety of different options for hip arthritis in terms of treatment, but also surgical techniques. And I offered him a technique that's called the hip resurfacing, and that basically preserves as much bone as possible while giving a patient the option to be able to run, tumble, and jump afterwards. A normal hip replacement, we strongly discourage patients from doing that just because it puts the implant at risk for fracture. But this technique allows him to do those kinds of activities. That's right. He's probably over 3 years or 4 years at this point, I think.
Yeah. Do you think he will be able to do it again for a long time?
I mean, I think he's asking a lot of his body, and he's got 3 things that are they're difficult to recover from 100%. And I think he's done very well, but he's trying to do things that are extraordinary, and so he's suffering a little bit because of that. I think if he was a normal person, his hip would feel fine, his knee would feel fine, but he's asking so much of his body right now, it's starting to fight back a little bit. And I think it's going to happen more as he gets older. I don't know. It's a matter of how much he's willing to put up with, a little bit of luck, and you know, doing good training, and all the activities that he's trying are helping. But eventually it's going to catch up to him. He's compliant. He's not someone who comes in and complains. You don't see him usually when he shows up there's something wrong, but he's always done what he's supposed to do. You know, if anything, you have to kind of hold him back. He's trying to do more than you'd like initially. The first 3 surgeries we've done, we didn't get paid at all. So it was only when he came back to see me for his hip replacement. I told him at that point, I said it's an issue really of more of getting him scheduled at the hospital. So hospitals require a certain you know, down payment, deposit, and things to get something done, and the implants. So I never billed him or charged him for the first 3. So he actually didn't know that he'd never been charged. It was sort of a courtesy that I did to him. I went into medicine to make people better, and so he was someone who needed something done, and we did what was right.